It does seem that it's almost like a four-legged stool. The patients are not really part of that, but it's in the insurance companies, the hospitals, the doctors, and the drug and pharmaceutical companies, and the way they have all worked together over these past 30, 40 years.
Well, they're often kind of codependent in very unproductive ways that say much more about the business of healthcare than about healthcare itself. I mean, what we find now is that even many of the patient advocacy groups are funded by pharma. So really, what's their message when they're funded by pharma? It's not, gee, why does this drug cost $70,000 a year? It's, why doesn't our insurance pay for it? You know, it's such a distorted kind of inflationary lens to look at healthcare through. In all of these healthcare debates in Washington, at the state level, at companies, no one really is representing the patients and their needs and their distress as they open these bills and face the $5,000 deductible or the 20% copay on insulin that's risen by 400% in the last 10 years. You know, so we need to speak up for our own interests here.
The other thing that seems to have happened at the same time is almost on purpose, an increasing complexity of all of this, making it more and more difficult for the patient to understand.
Yeah, and I don't think, you know, these things don't happen for business purposes in order to make a profit, but because they make a profit and because they're conducive to making money, there's no resistance to them. So in our system, you know, what you see happening is layers and layers of middlemen introduced. So say, for example, a joint implant. A company is charging $22,000 for that because, hey, there are only 4 joint manufacturers in the U.S. and some orthopedists like to refer to them as a cartel. You know, they're all charging a lot of money, way more than they charge in other countries, and it's in no one's interest to offer a discounted product. But what happens is the hospital says, wow, that's really expensive. So the hospital hires a joint negotiator who talks to a joint broker, and the manufacturer has a joint salesman. So someone calculated that there are 13 middlemen between that joint being produced and it being put into a patient's body. And those are all for-profit companies in the middle, and they're all taking, you know, their 10% cut. So why does a joint end up costing $22,000? Well, because there are a lot of people kind of feeding off that list price. And, you know, we heard it when the CEO of Mylan was taken to the congressional hearing saying, why does the EpiPen cost $600 now? And she said, oh, well, there are all these middlemen, so we don't get that $600. Now, you know, there are 2 layers of questions there. I mean, first of all, what value do the middlemen serve for those of us patients? And the answer is, you know, little to none. And the second question is, you know, why does an ancient drug put in a fancy new device deserve the same patent as the ancient drug by itself, which is really the life-saving entity? You know, epinephrine is cheap. EpiPens are hugely expensive just because epinephrine is in kind of a cool new package. And that may have some value. It's a slightly, you know, it's easier to use than a syringe and a little vial of epinephrine. But $200, $400, not if we were paying out of pocket. And I think that's why we're seeing people squawking now, because with high deductibles and copays, we are seeing these prices now. We are feeling them. And we weren't a few years ago when our insurance was covering things better. So now we see this widespread outrage at healthcare and healthcare costs. We see at the town hall meetings, people standing up and going, you know, don't take away my insurance. I can't afford this. I'm being, you know, I'm being devastated. I haven't gotten a raise in 10 years. Why? Because your employer has been increasingly paying more and more to health insurance costs.
Is there a tipping point in all of this? Is there a point that you can see where the system just collapses under its own financial weight?
Well, you know, I would have thought over the last few years we'd reached that tipping point. I mean, people spending 20 to 30% of their household income on healthcare costs, That to me is pretty near that tipping point. People not getting raises for 10 years because of healthcare costs, that should create a tipping point. But I think we haven't adequately connected all these hardships to things that are fixable, that we don't have to put up with. We've accepted this narrative of, well, healthcare is expensive. We're doing really important, valuable things for you. We have no choice but to pay this much for the drug. Otherwise, we won't get drug development. This is not necessary, and we're not getting results that are better than anywhere else in the world. In fact, for many diseases, studies show we're getting worse results. So don't just take this narrative, oh, we have the best healthcare and it has to cost this much because it's so very valuable. Well, no. We're paying 2 to 3 times as much as people in the rest of the world. I don't expect us to overnight get to any of those levels, but certainly we can turn the ship around and not be not taking summer vacations or going bankrupt or having our credit ratings dinged because of these really outrageous costs.
To some extent, it's hard to imagine that, except for anyone that is in the system and profiting from the system, that there can be any legitimate defenders of this current system.
Well, certainly many physicians feel extremely uncomfortable with this system. They do not think their patients are getting value, and it bothers them. There's one group of physicians who are a bunch of surgeons in northern Wisconsin, red state, red area for sure. And one of them said to me, I always felt like I was helping people by taking out their appendix. And then a patient came in to me and said, Doc, I feel better, but I just got this bill for $25,000 and I can't afford it. And this doctor, Hans Reichsteiner, said to me, I'd always felt good about being a physician, and then I realized in saving his life, I'd bankrupted his family. And so no, doctors, many of the good doctors in the system are so stressed by what's going on. So who are the defenders? You hear them certainly come from pharma. You hear them come from some of the hospital executives who say, what else can we do? Well, you look around the hospital and you say, gee, maybe you didn't have to buy the new wing. Maybe you could have reduced the bills, or maybe you don't need a curator and all this art. Maybe you should not charge so much for your outpatient surgery center. The defenders tend to be people who are profiting from the system, not the people who are just, and there are many people in the system who are just trying to deliver good health care. And that's, to me, the essential problem, that the values of health care are patience, helping people, caring. The values of business are efficiency, revenue generation, profit maximization. And, a lot of the people involved in our healthcare system are profit driven, and the values of medicine and the values of business intersect sometimes, but many times they don't.